how does FOURIER impact on management in clinical practice? I think that's obviously a very important question coming up after a presentation of the FOURIER data here at the ACC meeting. I think there are at least two important questions. One is the evidence is strengthening that the further LDL lowering below even our current threshold of 70 milligram per deciliter down to 50 or 30 milligram per deciliter, which was the target of FOURIER population, seems to give further benefit to the patients. The data from FOURIER fit very well on the regression line that we see from the CTT analysis, meaning that we can expect a cardiovascular risk reduction according to the absolute reduction in LDL cholesterol, and we have seen in FOURIER that this goes down until 30 milligram per deciliter. That's one very important question that will be relevant to discuss in the near future, how that impacts on our targets in clinical practice. The other question, of course, coming up, what are patients for whom we may consider PCSK9 inhibition? I think it comes out from the FOURIER, but also from this Bayer data that were presented at this meeting, that clearly the very high or severe risk patients will be patients where in the future we will consider this treatment, and I think there will be an important discussion in the field now how we can actually identify patients who will have most benefit from the therapy, because that should be the aim, to target the treatment to the patients who will have most benefit.